Today, we're diving deep into our own bodies to explore this hidden, invisible control system that's secretly running the show every single second of every single day. I mean, really stop and think about that for a second. How does your body just know when it's time to feel sleepy, or how to gear up for a stressful presentation, or what to do with the energy from that lunch you just ate? It's not magic, but it sure feels like it. It's actually a brilliant biological network doing its job. And that network has a name, the endocrine system. This is the body's master regulator. It's this incredible web of glands that are constantly talking to each other, using chemical signals to control so many of the things that make us, well, us. From our mood to our metabolism to our growth. So how exactly does this system talk? Well, it uses these amazing little things called hormones. You can think of them like tiny chemical text messages. They're sent out into your bloodstream and they travel all over your body carrying very specific instructions to different organs and tissues. They are literally the language of the endocrine system. Now, you might be thinking, wait, isn't that what the nervous system does? And you're not wrong, but they're two very different beasts. Your nervous system is all about speed. It sends lightning-fast electrical signals. Think pulling your hand away from a hot stove. It's immediate, but the effect is over in a flash. The endocrine system, on the other hand, plays the long game. Its hormonal messages are slower to arrive, but their effects are designed to stick around for much, much longer. So, how does this slower, more deliberate system actually get anything done? Well, it all comes down to a crack team of specialist glands. Let's meet some of the key players who are in charge of this whole operation. First up, we've got the pituitary gland. People call this the master gland, and for a very good reason. It's this tiny little thing at the base of your brain, but it acts like the conductor of a huge orchestra. It releases hormones that tell most of the other glands what to do and when to do it. It's the boss. Next on the team are the adrenal glands, which sit right on top of your kidneys. Think of these as your body's dedicated stress managers. Whenever you're feeling under pressure, they're the ones pumping out hormones like cortisol to help you manage that fight or flight response. Super important stuff. Ever have one of those days where you feel super energetic or maybe totally sluggish? Well, you might have your thyroid gland to thank for that. This little butterfly-shaped gland in your neck is basically the energy regulator for your entire body. It controls your metabolism, the speed at which your cells burn fuel. It's a huge player in your day-to-day energy levels. Then we have the pancreas, which I like to call the sugar controller. This organ has an absolutely critical job, keeping your blood sugar levels in that perfect, just right zone. It releases insulin when sugar is too high and another hormone, glucagon, when it's too low. And hang on to that thought, because the pancreas is a perfect example of how this whole system works. We'll come back to it. And wrapping up our tour, we have the tiny pineal gland tucked deep inside the brain. This is your body's personal sleep clock. Its job is to produce melatonin, the hormone that governs your sleep-wake cycles. It's what tells your body, hey, it's getting dark out, time to start winding down. Okay, so we've met the team, but how do they all coordinate? How do they know what to do without sending the whole system into chaos? Well, it turns out they follow a really simple but incredibly powerful set of rules. And these rules are all designed to do one thing: keep everything in perfect balance. The main goal here has a scientific name: homeostasis. But really, all it means is maintaining a stable internal balance. The system achieves this using something called feedback loops. The best way to think about it is like a smart thermostat for your body. If things get too hot or too cold, or, too high or too low, a feedback loop kicks in to bring everything back to the normal range. And there are basically two types of these loops. You've got positive feedback, which amplifies a signal. It's like a snowball rolling downhill, getting bigger and bigger. This is pretty rare, and it's used for very specific events like childbirth. But the real workhorse, the one that's running constantly, is negative feedback. This is the mechanism that says, whoa, okay, that's enough, and it shuts the signal down to bring things back to normal. It is by far the most common. So let's put some of this theory into practice. Seeing this master rule, negative feedback, in action is really the key to understanding how this whole amazing system keeps you alive. All right, let's go back to our old friend, the pancreas. So picture this. You've just finished a delicious meal. The carbohydrates break down into sugar or glucose, which then enters your bloodstream. As you'd expect, your blood glucose levels start to climb. Your body immediately senses this change, and that's the cue for the pancreas, our sugar controller, to jump into action. It releases a hormone called insulin. Now, insulin's job is super important, but also pretty simple. It acts like a key that unlocks the doors to your cells, allowing all that glucose to get out of the bloodstream and into the cells where it can be used for energy. And here is the genius of the feedback loop. As your cells start soaking up that glucose, the sugar level in your blood begins to drop. And that drop is the signal. It travels back to the pancreas and essentially says, okay, mission accomplished. You can dial back the insulin now. The system automatically shuts itself off. It's a perfect self-correcting balancing act. But it's not always just a one-step process. Some of these loops are more like a chain of command. Let's take the thyroid again. This whole process actually starts in the brain with the hypothalamus. It sends a signal to the pituitary gland, the master gland, remember? The pituitary then sends a second signal to the thyroid, telling it, okay, it's time to release your energy hormones. So how does this whole chain reaction know when to stop? Well, the final product, the thyroid hormones themselves, are the feedback signal. Once their levels in the blood get high enough, they essentially call home to the brain and the pituitary gland and say, hey, we're good down here. You can take a break. This is that beautiful negative feedback loop in action, shutting down the whole chain to prevent it from overproducing. And this brings us to a really crucial point. This system is absolutely incredible when it's all working smoothly. But what happens when one of these delicate feedback loops breaks? Well, the stakes for your health become incredibly high. And this is really the so what of this whole conversation. As this quote says, most diseases of the endocrine system, things like thyroid disorders or diabetes, happen because a negative feedback loop fails, that off switch breaks. This leads to hormone levels getting stuck either way too high or way too low. And that imbalance can cause all sorts of problems all over the body. So, as we wrap up, just think about that for a second. Right now, as you're sitting here, this silent, incredibly powerful network of glands and hormones is performing this unbelievably complex balancing act inside you, all to keep you alive and well. It's truly your body's hidden control system, and it is absolutely amazing.
All right, today we're diving into a story about hormonal balance, about control inside your own body. It's a tale of what happens when the body's instructions go, well, a little haywire. And it all centers on one tiny but unbelievably powerful gland.
So picture this. Your body has a master builder, right? And it's carefully managing all your growth and repair. But what if that builder just never gets the memo to stop working? Or maybe even worse, what if it barely shows up for the job at all? Let's find out.
Okay, so first things first, let's meet the main character in our story, the pituitary gland. So you see it here called the master gland, and honestly, it's the perfect name for it. Just think of this tiny little thing at the base of your brain as the CEO of your body's entire hormone system. It's sending out all these crucial orders that control everything from your metabolism to your growth. It's a big deal. So if the pituitary is the CEO, one of its most important managers has got to be growth hormone. Let's take a look at its job description. Now, growth hormone, or GH, isn't just for growing taller when you're a kid. Not at all. It's basically a lifelong maintenance worker. It helps repair your cells, it manages your metabolism, and it keeps your muscles and bones strong your entire life. It really is the blueprint for how your body builds and maintains itself. But here's the thing. GH isn't a solo act. It signals the liver to produce a partner hormone called IGF-1. You can think of GH as giving a daily instruction, which, can go up and down like crazy. IGF-1, on the other hand, gives us the big picture. It's like a steady average of all that GH activity over time. And that makes it incredibly useful for doctors who are trying to piece together what's really going on. And this is where our story takes a turn, because with a system this powerful, any kind of imbalance can have some really dramatic consequences. So here's the bottom line. Things can go wrong in two completely opposite ways. On one hand, you've got growth hormone deficiency, where the pituitary is just not making enough. And on the flip side, you have acromegaly, where it's making way too much. They're really two sides of the very same hormonal coin. All right, let's open up our first case file. Let's investigate what happens when the body's master builder doesn't provide enough of that essential blueprint. So you might be wondering, why would production just slow down? Well, it's not always super clear, but the causes can range from physical trauma or an infection to even the side effects of treatments like radiation. And sometimes the problem isn't even the pituitary itself, but its own boss, the hypothalamus, sending it the wrong signals. And, the effects of this deficiency really depend on your age. In kids, a lack of growth hormone leads to the obvious result: impaired growth. But in adults who are already done growing taller, the symptoms are a lot more subtle. Because GH is so important for regulating body composition, its absence causes this shift. You get less muscle, more body fat, especially around the waist, and this just persistent, draining fatigue.
Okay, now for our second case file, acromegaly. This is what happens when the body's builder goes into complete overdrive and just never, ever gets the message to stop.
So what's the cause here? Well, the overwhelming reason for acromegaly is a benign, and that just means non-cancerous tumor right on the pituitary gland. This little cluster of cells basically goes rogue. It ignores all the body's normal signals and just keeps pumping out massive amounts of growth hormone, 24/7.
Now think about it. If you're an adult, you're not going to get any taller. So where does all that extra growth signal go? It goes outward. Bones in the hands, feet, and face start to thicken and enlarge. And this leads to these very distinct physical changes that develop really slowly over years.
But the effects go way, way beyond appearance. There's a handy little mnemonic, A, B, C, D, E, F, that helps show just how widespread the impact is. A is for arthralgia, which is just joint pain. B is for increased blood pressure. C is for carpal tunnel syndrome from all that tissue overgrowth. D, that stands for diabetes. And this happens because huge amounts of growth hormone can actually get in the way of insulin's job. E is for enlarged organs. And finally, F is for field effect, which is about vision changes that can happen if the tumor itself gets big enough to press on the optic nerves. So, with these really serious consequences on both ends of the spectrum, how do doctors even begin to figure out what's going on and try to get that delicate hormonal balance back?
Well, it's really a two-pronged approach. First up, lab tests. Remember our friend IGF-1? Seeing its level elevated is the key marker that confirms there's too much growth hormone activity. Then you've got imaging, like an MRI scan. That gives the visual proof, letting doctors actually see the pituitary tumor or the changes in bone structure.
Once it's diagnosed, the goal is pretty straightforward. You've got to turn down the volume on that growth hormone. The most direct way is often surgery to remove the tumor. If that isn't an option, or it doesn't get at all, radiation can be used to shrink it. And there are also powerful medications that can either block the hormone's production or stop its effects on the body.
You know, if you take away just one thing about acromegaly, let it be this simple but really powerful summary. It perfectly explains why we see such a huge range of symptoms, everything from enlarged hands to an enlarged heart. That growth command is just active everywhere.
And that really leaves us with a final thought. The story of growth hormone is such a dramatic example of a single system being thrown completely out of balance. It kind of makes you wonder, what other incredible, microscopic balancing acts are happening inside our bodies right now just to keep everything running smoothly?
All right, let's dive into one of the body's unsung heroes. We're talking about a tiny gland that acts as the master regulator for your entire body. Basically, it controls your speed, your energy, your metabolism. We're talking about the thyroid. So have you ever had one of those days or maybe even weeks where your body's engine just feels off, Maybe you're running way too slow, you're sluggish, you're cold when nobody else is. Or maybe you're running way too fast, you're buzzing with anxiety and just can't cool down. Well, there's a very good chance that the small gland we're about to talk about is the one pulling all the levers behind the scenes. And here it is. This is the thyroid. It's this small butterfly-shaped gland right at the front of your neck. And its main job? Well, think of it as your body's internal thermostat and its gas pedal, all rolled into one. It pumps out hormones that literally tell every single cell in your body how fast to work. And it is absolutely incredible how much this little gland is in charge of. Its two main hormones, you might have heard of them, T3 and T4, are basically the project managers for your body's most vital functions. They control how quickly you burn calories, how much energy you have, how fast your heart beats, your body temperature. They even play a huge role in growth and development. That is a massive amount of responsibility for such a tiny organ. Okay, so if the thyroid has all this power, how does the body stop it from, going completely haywire? Well, it turns out there's this really elegant, really clever communication system that keeps everything in perfect balance. It's basically a three-step chain of command. It all starts up in the brain with the hypothalamus. It sends out a little signal called TRH. That signal goes to the pituitary gland, which then sends out its messenger. This one's called TSH, or thyroid-stimulating hormone. And that TSH travels down to the thyroid and gives it a direct order. Hey, time to make more hormones. Now, this is the really brilliant part. As soon as the levels of those T3 and T4 hormones in your blood get to be just right, they send a signal all the way back up to the brain that basically says, okay, we're good down here. You can stop shouting now. This tells the brain to pause the signals, which stops the hormone levels from getting too high. It's a perfect self-regulating masterpiece. But what happens when that masterpiece of a system breaks down? Well, that's when we start running into problems. And the two main issues are really just two sides of the exact same coin. We call them hypothyroidism and hyperthyroidism. It really all comes down to speed. With hypothyroidism, think hypo as in low, the gland isn't making enough hormone, so all of your body's processes just slow way down. Now on the flip side, you've got hyperthyroidism. Think hyper like high energy, where the gland is making way too much hormone and your metabolism just kicks into overdrive. And you can really feel that difference. The symptoms are just perfect opposites of each other. Hypothyroidism brings that slow down. You feel cold all the time, you gain weight, you're exhausted, and you have a slow heart rate. Hyperthyroidism is the total speed up. You can't stand the heat, you're losing weight without trying, you feel anxious, and your heart is racing. This whole thing is also perfectly reflected in your lab results. With hypothyroidism, your actual thyroid hormones, T3 and T4, are low. So what does the brain do? It screams for more, which means your TSH is high. With hyperthyroidism, your T3 and T4 are already way too high. So the brain is just whispering, trying to get the thyroid to stop, which means your TSH is super low. It's just like a seesaw. So as you can probably guess, the treatments are polar opposites too. For hypo, the goal is pretty straightforward. You just replace the hormone that's missing, usually with a lifelong medication. But for hyper, the goal is the reverse. You have to reduce hormone production, and that can involve meds, radioactive iodine to slow the gland down, or sometimes even surgery. Now, it's really important to note that while these conditions are very manageable, if they go untreated for a long time, they can escalate into genuine medical emergencies, situations where the body's systems are pushed to an absolute breaking point. On the slow end of the spectrum, severe hypothyroidism can lead to something called a myxedema coma. This is a state of dangerously low body temperature, a very slow heart rate, and even loss of consciousness. On the fast end, severe hyperthyroidism can trigger a thyroid storm, which means an incredibly fast heart rate, a high fever, and extreme agitation. Both of these are absolutely life-threatening. Okay, that was a lot of information. So what's the one thing you should absolutely remember from all of this? If you walk away with just one concept today, please make it this next one. It really is this simple. Hypothyroidism is cold and slow. Just think of weight gain, fatigue, always feeling chilly. And hyperthyroidism is hot and fast. Think weight loss, anxiety, feeling overheated all the time. If you can just lock that in, you've really understood the fundamental difference between these two conditions. At the end of the day, all of this is a great reminder that our bodies are constantly talking to us. They speak in a language of symptoms. They're sending us signals. And the real question is, are we paying close enough attention to what they're trying to tell us? All right, so today we're going to dive into a pretty fascinating story of balance and imbalance. It's a tale of two hormonal extremes that can happen right inside our own bodies. We're talking about the adrenal glands and what happens when their delicate system goes, well, completely haywire. So let's just start with that big question, right? What actually happens when your body's main stress hormone either just shuts down completely or goes into total overdrive? The results are, believe me, dramatic, and they tell us so much about how our bodies fight to maintain harmony. Okay, to really get this, we first need to meet the stars of our show, the adrenal glands. Now, these are two little glands that sit right on top of your kidneys, and you can think of them as the powerful control center for your body's entire stress response. And the main character in this whole drama is a hormone called cortisol. Now, yeah, we call it the stress hormone, but honestly, it does so much more. The best way to think of it is like your body's internal thermostat. It's constantly adjusting your metabolism, your blood pressure, and how you react to any kind of stress. So, what happens when that thermostat breaks? Well, that leads us right to our first extreme scenario. Let's explore what happens when that cortisol thermostat is sent way, way too low, when the well of this crucial hormone starts to run dry. This condition is what's known as Addison's disease. So what is Addison's disease exactly? To put it simply, it's a state of deficiency. It's what happens when your adrenal glands get damaged, a lot of times by your own immune system, and they just can't make enough cortisol and another important hormone, aldosterone, anymore. With Addison's, you get this cascade of lows across the board. The low cortisol is the trigger, right? Without it, the body can't maintain its blood sugar, which leads to hypoglycemia. It also can't manage sodium and water balance, causing blood pressure to drop. All of this results in pretty significant weight loss and this just crushing fatigue. The whole system is basically running on empty. But there is one really unique telltale sign. People with Addison's can develop this kind of bronze-like color to their skin. Now, why does that happen? Well, as the adrenal glands are failing, the pituitary gland up in the brain is desperately trying to wake them up. It's just pumping out this hormone called ACTH. And a weird side effect of all that extra ACTH is that it also stimulates melanin production, and that's what darkens the skin. So if you need a super easy way to remember all this, here's a great little tip. Just think Addison's means low everything. Low cortisol, low blood pressure, low sugar. It's a simple trick, but it's a really effective way to keep the main features straight in your head. All right, so we've seen what happens when the thermostat is set too low. Now let's flip the script completely. What happens when the cortisol floodgates are thrown wide open and the system gets stuck on high? This state of chronic overload is called Cushing's syndrome, and it's the total polar opposite of Addison's. Here, the body is just overwhelmed by huge amounts of cortisol, a lot of times because there's a tumor somewhere that's causing the adrenal glands to go into overdrive. And just like Addison's, Cushing's has its own really distinctive physical signs. One of the most classic is what's called a moon face. This happens when those sky-high cortisol levels cause fat to get redistributed and deposited in the face, which makes it look really round and full. Another textbook sign is the buffalo hump. You can see it here. It's this accumulation of fat on the upper back between the shoulder blades. These very clear visual cues are powerful signals that the body's cortisol levels are dangerously high. And here we see the exact opposite profile of Addison's. Everything is trending high. Way too much cortisol is constantly telling the body to make more sugar, which leads to hyperglycemia. It also makes the body hold on to fluid, which drives blood pressure way up. And instead of weight loss, patients get weight gain, especially around their midsection. The skin also gets super thin and fragile, and you often see these distinct purple stretch marks. So what's the memory aid for this one? It's just as simple. Think, Cushing provides a cushion. This little phrase helps you remember all that characteristic fat buildup in the face, the back, and the abdomen that really defines the condition. Okay, so we've met our two hormonal extremes. Now let's put them side by side for the ultimate showdown. Because when you see them in direct comparison like this, their opposing natures just become crystal clear. I mean, at its very core, this is the entire story in a nutshell. On one side, you've got Addison's, a disease of too little, and on the other, you've got Cushing's, a disease of too much. It's just a perfect study in this kind of hormonal dualism. And just look at this table. The contrast on every single metric is so stark. For cortisol, low versus high. Blood pressure, low versus high. Blood sugar, low versus high. And for weight, it's loss versus gain. They are perfect, dysfunctional mirror images of each other. So the big question is, how do we fix this? How do we get that internal thermostat working right again? Let's take a look at the path to treatment and see how medicine can help restore this incredibly delicate hormonal balance. For Addison's disease, the logic is pretty straightforward. If the body isn't making enough of a hormone, you simply replace it. The treatment is lifelong hormone replacement therapy, using medications that give the body what the adrenal glands can no longer produce. Now, treating Cushing's is a bit more complex, because here the goal is to shut down that overproduction. The exact approach really depends on the cause, but it often involves things like surgically removing a tumor, sometimes using radiation, or giving medications that lower the body's cortisol production. So when you step back, this whole tale of two diseases really shows us just how exquisitely balanced our bodies are. See, cortisol isn't good or bad. It's all about having just the right amount. Understanding these extremes really highlights the vital importance of our body's internal harmony. And that leaves us with one final thought to chew on. We've just seen how critical that cortisol thermostat is. But it makes you wonder, right? What other incredibly complex systems, what other body thermostats for our temperature, our thyroid, our blood sugar, are working perfectly in the background every single day, completely unnoticed? It's pretty amazing to think about.
All right, let's talk about diabetes. You know, it's a word we hear all the time. It affects millions of people. But what's fascinating is that it's not just one thing. It's really a tale of two very different conditions, both revolving around what happens when our body's most critical fuel system just breaks down.
So let's kick this off with a pretty intense thought. What if the very thing that's supposed to fuel your body, the source of all your energy, what if it turned against you? What if it became a poison, damaging you from the inside out? Well, that's not just a scary thought experiment. That is the core crisis of diabetes.
Okay, so before we can really get into what goes wrong, we've got to understand how it's all supposed to work, right? So let's break down the basics. We'll meet the key players in our body's amazing fuel system.
First up, you've got glucose. The easiest way to think about glucose, it's like premium fuel for your body. I mean, every single cell, from the ones in your brain doing all that thinking to the muscles that let you move, they all run on it. It's literally the energy that keeps the lights on. But here's the catch. Glucose is powerful, but it can't just barge into your cells whenever it wants. It needs an invitation, a special key. And that key is insulin. Your pancreas makes this hormone, and its whole job is to travel to your cells and, unlock the door, so all that good glucose can get inside and get to work.
So you can probably see where this is going. What happens when this whole key and lock system breaks down? Well, if the key is missing, or maybe the lock is just rusty and won't turn, that glucose gets stranded. It's stuck outside the cells with nowhere to go. It just starts piling up in your bloodstream, creating this massive sugar traffic jam. That pileup has a name: hyperglycemia. And that, right there, is the #1 problem in all forms of diabetes.
All right, that brings us to our first story, type 1 diabetes. If we stick with our analogy, this is the classic case of the missing key. And it all starts with a huge, unfortunate mistake made by the body itself.
So with type 1, what happens is the body's own immune system gets confused. It looks at the perfectly healthy, hardworking cells in the pancreas that make insulin, and it thinks they're enemies. It attacks and destroys them. And once those little insulin factories are gone, they're gone. The body just can't make the keys anymore. And no keys means that glucose is locked out of the cells for good.
Now, when the body is in this state, it starts screaming for help. It sounds the alarm with what doctors call the 3 Ps. First, polyuria. You start urinating a lot. Your body is desperately trying to get rid of all that extra sugar. This, of course, makes you super dehydrated, which leads to the second P, polydipsia, or just intense thirst. And at the same time, your cells are literally starving for that locked-out fuel, so your brain cranks up your hunger signals. That's the third P, polyphagia, or excessive hunger. Those are the classic red flags.
Okay, so that's type 1. Now let's switch gears to our second story, type 2 diabetes. And this is a completely different ballgame. Here, it's not about a missing key. The key is there. The problem is a rusty lock. See, with type 2, the pancreas is usually still pumping out insulin. In fact, sometimes it's working overtime, making even more than normal. The breakdown is happening at the other end, at the cells themselves. They've become resistant. It's like the locks have gotten all rusty and stiff. The insulin key just doesn't fit in as well as it should, and it's a real struggle to get the door open. So even with tons of keys floating around, the glucose just can't get in efficiently. And while the science behind it is pretty complex, we know that this insulin resistance is super closely tied to a few major risk factors. Things like obesity, not getting enough physical activity, and also just genetics. Sometimes it runs in the family. A lot of these things have unfortunately become way more common in our modern lives. So let's just recap and put these two side by side, because this is really important. You've got type 1, that's an autoimmune issue. It often shows up in kids or young adults, and the treatment is lifelong insulin. Period. Then you have type 2. That's an insulin resistance problem. It usually appears in adults, and the first line of defense is often lifestyle changes and maybe some oral meds. Two totally different mechanisms, two different approaches. They just happen to share the same name.
Okay, so how do doctors tell the difference and make a diagnosis? Well, it really just boils down to the numbers. A couple of simple blood tests tell the whole story.
Basically, there are two big ones. The first is your fasting glucose. This is just a snapshot of how much sugar is in your blood at that one moment. Normal is under 100. If you're at 126 or higher, that's a diagnosis of diabetes. But the other, and maybe even more important test, is the A1C. The best way to think of the A1C is like your 3-month average for blood sugar. It's not a snapshot, it's the big picture. Here, under 5.6% is considered normal, but if you hit 6.5% or more, that's a solid diagnosis.
And once someone is diagnosed, managing diabetes it's a constant balancing act. It's not just about one number. It's about staying out of the danger zones, avoiding the immediate risks of going too high or too low, while also playing the long game to prevent some really serious damage down the road. That's why control is just everything. Let's talk about the immediate dangers, starting with going too low. This is called hypoglycemia. It's when your blood sugar dips below 70. Suddenly, your body is running on empty. You might start shaking, feel confused, get a cold, clammy sweat. This is a real medical emergency that has to be dealt with, and fast.
Luckily, for a mild low, there's a really simple and effective fix. It's called the 15-15 rule. It's super straightforward. You consume 15 grams of something sugary that acts fast. Think a small glass of juice or a few glucose tablets. Then you wait 15 minutes, and then you check your blood sugar again to see if it's come up.
Then you have the other side of the coin, hyperglycemia, or high blood sugar. And the symptoms here might sound familiar. It's often those same warning signs all over again. That crazy thirst, having to use the bathroom all the time, maybe hot, dry skin. And while it doesn't always feel like an immediate emergency, this is the state that, over the long haul, causes the real, lasting damage.
Why? Because here's the really sneaky, dangerous part of high blood sugar. All that extra glucose floating around in your blood, it starts to act like tiny, microscopic shards of glass. And over time, it just scrapes away at the delicate inner lining of your blood vessels, all of them, from the biggest arteries right down to the tiniest little capillaries.
And when this happens in those tiny small vessels, it kicks off a whole chain reaction of problems. It can cause nerve damage, which we call neuropathy. That's where people get pain or numbness, especially in their feet. It can wreck the kidneys, which is nephropathy. And it can damage the delicate blood vessels in the back of the eye. That's retinopathy, and it's one of the main reasons people lose their sight. And the damage isn't just to the small vessels. When the large blood vessels get damaged, the results are just as serious. We're talking about a hugely increased risk for things like heart disease and stroke, and also poor circulation to the legs and feet, which is called peripheral artery disease.
So there you have it. We've gone through the mechanics, the missing keys of type 1, the rusty locks of type 2. We've looked at the numbers that define it and the really serious risks that come with it over time. And it all leads to this massive, critical question. And it's not just a question for individuals or their doctors, it's for all of us. As millions and millions more people around the world face this reality, how do we, as a society, get better at not just managing it, but preventing it in the first place? That is the huge challenge in front of us.